Hello, my name is Chu, and I am a student physical therapist at Regis University. I will be telling you a little bit about pain in this presentation. So, what is pain? The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in such terms. So there are two different types of pain that we know of as of now, and this is acute and persistent pain. Acute pain is the result of damage to tissues. This can be slicing your finger open or an airbag smashing into your face during a car accident. This is important as it serves as protection and prevents us from continually damaging tissues. This allows for healing to take place. Persistent or chronic pain is pain that continues past the tissue healing time. This is when pain has become a disease and is no longer a symptom. Unlike acute pain, it is not used as protection and actually has no purpose. This makes it difficult for healthcare providers to find a treatment. Did you know that 1 in 6 Americans live with persistent pain, according to the American Chronic Pain Association? This tells us there is a need for more study about chronic pain. So let's zoom in a bit to look at the mechanism of pain from a neurological perspective. When we are exposed to a noxious stimulus, let's say you prick your finger with a pin, pain receptors, called nociceptors, fire in response to the stimulus. The stimulus then travels via A delta and C fibers, which are fibers directly related to pain. They eventually end up in the spinal cord, to the dorsal horn, and synapses on a second neuron in the substantia gelatinosa. It crosses midline of the spinal cord and joins the spinothalamic tract. The signal then travels to the ventral posterolateral nucleus, where it synapses on a third neuron. The signal is then sent to the primary somatosensory cortex, which interprets the pinprick as pain. What our brains decide to do with the information is completely contextual. So some interventions that we use to treat pain include medications, just management such as meditation, and I'll be talking a little more about that in subsequent slides. So acute pain actually follows the biomedical approach, which makes it easy for healthcare providers to prescribe medications to deal with pain. Persistent pain does not follow the biomedical approach and is a whole nother beast in terms of interventions. Persistent pain has a strong relationship with psychological health, and intervention should encourage small behavioral changes. We need to look at the biopsychosocial model, which gives equal emphasis to physical and psychological domains. So, suffering is the emotional and cognitive response to pain. This can lead to depression and the idea that pain is permanent. So, what do we do to help patients psychologically? Behavioral therapy is one way that therapists do this. So, this entails educating the patient about their pain condition, encouraging patients to participate in activities they have been avoiding, and cognitive restructuring exercises. So, cognitive restructuring exercises involve increasing awareness of the role thoughts and emotions play into making their pain worse. Patients need to learn how to introduce and practice coping thoughts and behaviors. Eventually, patients will learn how to shift negative thoughts to positive thoughts. Another method is relaxation training. This is a useful technique to induce muscle relaxation and downregulate the sympathetic nervous system. The sympathetic nervous system, in response to pain, actually increases your heart rate and increases your metabolism. while the parasympathetic nervous system calms you down and you want to upregulate the PNS. Exercises can include yoga, breathing exercises, and meditation. Pain is a convoluted concept, but much is being done to fully understand it. As physical therapists, we will be dealing with many patients whose main concern is their pain. There are new theories and evidence always emerging, and by understanding the new models of pain, your effectiveness as a clinician can increase. Thank you for listening to the short blurb about pain. I hope this has deepened your understanding. Special thanks to Erica Nelson Wong and her amazing ebooks. Thank you.